To me, health equity means justice.
Everybody has an opportunity to thrive.
It means having healthy families.
So what we've realized at the California Endowment and elsewhere is that health is really about the ability of people to participate in decision making, the ability for people to have agency or power.
What's been beautiful about being with this organization, going on 15 years now for me, is how each phase of development and achievement has built on the platform that was erected before.
You know, the California Endowment is a child of the law of unintended consequences. Back in 1986, Congress amended the tax law and made all the Blue Cross organizations taxable, even though they were nonprofits. Well, they had a very difficult time competing with their for-profit competitors. After Blue Cross of California had almost gone bankrupt, they came upon a scheme to have stockholders and bondholders so they could have the capital they needed to survive. And that unleashed a maelstrom.
You have to be outraged. You just have to say, this is not fair. Blue Cross of California wanted to convert to become a for-profit organization.
It was extremely contentious to go from not for-profit to for-profit. That's considered a conversion, and the law requires them to disgorge their assets.
Blue Cross decided to and announced they would set aside $100 million for charity and made that deal with one of the legislators. The consumer groups just went ballistic.
And we looked at this and said, no, that's not right. Those are public assets. How can we make sure that they're used for the public good?
Inside Blue Cross, there was consternation at the fact that they needed access to capital in order to stay in business and compete. The people who were criticizing didn't understand the internal problem of Blue Cross, and the people in Blue Cross didn't really understand the motivation and position of the people on the outside.
This was a statewide battle of all interested parties. And so we helped put together a coalition of labor, grassroots organizations, community-based organizations, ethnically based organizations, minority organizations, and faith-based organizations all over the state. It was a lot of hard work by many groups and many individuals. We're holding news conferences, demonstrations, and we're petitioning the commissioner. This is a legal petition to petition government for Blue Cross to divest itself of assets. The resources should be placed in an independent, nonprofit foundation dedicated to the health care needs of Californians, with special emphasis on underserved and low-income populations. The governing board should be comprised of and be reflective of the diversity of the state with regard to race and gender and other relevant factors.
One of the extraordinary things about the endowment from the very first was the diversity of the board and staff.
The first board of directors, I thought, was a group of some of the most incredible people I've ever met in my life.
So there were over 2,000 nominees vetted for this board. They were reviewed by 4 search firms. They were reviewed by community advisory groups, ethnic consultants.
And they were from all over the state, people such as the head of the Getty and the head of YWCA, the head of Indian Health from Sacramento, a former Goldman Sachs banker, a leader in Asian health in Oakland, from all over and from all walks of life.
This board, the beginning board, we were just people. but we were people with different perspective, different background, different agendas, if you will.
We ended up with one of the most diverse foundation boards in the entire country.
Geographic diversity, gender diversity, racial diversity. What I found very unique about our board is that there were very rich discussions, disagreements, debates.
Some of the board members talked about philanthropy as like investing. Some board members talked about philanthropy as community organizing. Others had perspectives about philanthropy as communication for change. All those different voices existed on that initial board, and I think that it helped us create a very effective tool for change in California.
And then the same thing happened with the staff. I mean, we were a very multicultural staff, to the extent that the staff really brought those values very early on.
Right out of the gate, we had 12 months to get something like $120, $150 million out the door.
We couldn't believe we were in charge of such an enormous opportunity.
It was like winning the revolution. You know, we knew that we could really make fundamental difference.
I don't think any of us, as I recall, came from philanthropy. We were advocates, we were community organizers, we were, people that had worked in the field.
We didn't want to do it the easy way. In other words, we didn't want to just do a few checks, big checks, to institutions that would have been more than happy to have taken the money. We really were committed at finding organizations that could take this money and do some powerful work with it.
Day one, the whole thing was unique. There was no bureaucracy.
No processes.
No rules.
Without any strategic plan.
Nothing. We had nothing.
Not even an office.
Working out of our houses and coffee shops and restaurants.
There was a time that the whole board sat and reviewed all of the applications. Now that was something.
We all lived in different parts of the state, and we would come together in LA for 2 days at a time, every week or every other week, and worked almost 12 hours a day in a closed room debating these issues.
Language appropriateness, having cultural competency.
How does the community play a role? How does the community decide?
The special conditions that exist for different populations.
What does it mean to invest in advocacy?
Huge disparity problems in California, not just in terms of race and ethnicity, but geographic distribution.
And so, yeah, we would have these long kinds of conversations constantly about what this all added up to.
From the very beginning, the California Endowment wanted to be a foundation that listened. So we didn't listen once a year. We didn't listen in San Francisco. We didn't listen to one organization. We listened to everyone.
When Lou Reed became the interim executive director of the foundation at a very difficult time of our evolution, one of the first things that he did was to get the board out of their boardrooms in the crystal glass hotels at the airport and take them out to communities and really see firsthand where communities live and work.
At the May 99 meeting, we had our meeting around the table, as boards generally do, and then we said, let's get out of here. Let's go see some other things. These visits were very important to many of the board members who had never been in the nonprofit sector, who had never worked with the underserved, who weren't healthcare professionals, because it showed them a side of society that they'd never seen and gave them concrete examples of what the endowment was doing.
We proceeded to have hearing sessions with the communities. We had like 4 or 5 different hearing sessions, and we made sure to invite not just the usual suspects of healthcare delivery, but brought in law enforcement, education, community organizers, and leaders from the community who up to that point wouldn't be considered part of the health fabric of the community.
It was our way of bringing that voice to the table that up until then really hadn't had that opportunity.
It was trying to find the innovation that was out there, but not listened to, not invested in, not brought to life.
That opportunity allowed us to really dig deep in terms of understanding the health needs of different rural communities. urban communities, the African American disparities in health versus access issues faced by Latinos or newer communities such as the Asian immigrants, and the idea that we didn't have to choose one over the other. We had enough resources to make a significant impact in many important areas in the state.
We've done that ever since, where our board has a tradition of doing listening tours, learning tours, site visits. It takes a lot of time, but it's well worth it.
Absolutely an important conclusion of that first board process was that race and culture were fundamental to health status.
From the very beginning, one of the taglines that the foundation used was a multicultural approach to health. There was a very broad definition of what that meant. There was a particular emphasis on racial and ethnic minority communities, women, gay and lesbian, bisexual and transgender communities, disabled communities, immigrant and refugee communities, rural communities, that this was a very broad approach that really reflected the diversity of California and therefore also was really important in the grant making that the foundation did.
In the early days, we did talk quite a bit about health care. But I can remember the board meeting where we really introduced to the board the discussion about health and why we needed to talk about health and not just health care. Because once we start talking about health, we're talking about a much broader set of issues than whether the delivery system is capable of treating us. What are the big gaps between people across the state, between communities, different population groups, that result in some people being so much healthier or having so much more health opportunity than others? And that really brought us squarely into the discussion of health disparities.
The big step forward was when we started to define who we were as a foundation from our original mission. But in 1998, taking it to that next step of recognizing that community building and multicultural health were critical components of what the California Endowment would be about in the future. So that really launched our Communities First program.
You know, and the thing with Communities First that I think was so special about it is we always really wanted to make sure that communities were at the center of that proposal, of that idea, and that there is strength in that community, and there's power in that community, and that we really wanted to see how this work was being done with community.
Well, another thing that I worked on was an effort to expand coverage for children. A community got together and said, what would it look like if we made a commitment to provide universal coverage, that's dental, vision, and health coverage for every single child in our community? And a significant number of children who are without coverage are undocumented. Not a popular subject. But the board was adamant. The board said all children means all children. In fact, all Californians means all Californians.
This work matters because it's literally life and death. We spend $3 trillion on health care in this country, and it does a very poor job of actually creating health. In fact, I often ask people, who are the healthiest people in your life, and how much time do they spend in the hospital? And the things that matter more are really the environments in which people live in and the opportunity structures like education, housing, employment.
And we looked at health disparities not as an issue that the healthcare system could solve, because people showed up at the door of the healthcare system with their disparities in tow. We really had to look much further upstream. Policy is made in higher places, whether it's the state capital or, county boards of supervisors. And how do we really bring that community voice into that arena.
It's about the ability of people to meaningfully participate in the decisions that impact their lives. And most of the things I'm talking about now are decided in political venues.
I think sometimes you have to change it by political will and forcing change. I think sometimes you have to stand up and be willing to get knocked down.
So the idea that the Endowment, which was a private foundation, to say that it was able to endorse the role of advocacy, the idea that it would actually say openly that it would fund advocacy, that was really an important breakthrough for this foundation and hopefully had lessons for other foundations around the country.
Advocacy became a way of lifting up and amplifying the community's voice and passion and creativity so that now they became captains of their own destiny rather than just a receiver of a grant.
For a philanthropy to say we are going to devote 10 years worth of financial resources, human resources, technical resources, political capital to the hardest to reach communities.
To say, we will partner with you.
To really tackle their priorities.
Building assets, building power.
With every grant-making strategy we can think of to bring to you. Where to go? That was the question. We created a bus tour. California is a big state, and we went to 25 different communities. We gathered together all the leaders and the nonprofits in those communities for a listening session. In fact, multiple listening sessions. We had data, we had mapping, and in some cases, we went back. And people were very honest with us. So it was really the culmination of that kind of community responsiveness that had been a value of the endowment for a long time, and the desire to take significant resources and change things and not be afraid.
It became a natural evolution of what we believed. If you really believe that community leaders have creativity, energy, passion to solve problems, then you're going to fund them that way.
Grew up in this area my whole life. Now I have an opportunity to be a voice for our community.
To address the issues that they saw.
We're talking just some substantial policy changes that we want to make here.
Huge investment. We're not going to just, do 2 or 3 communities and see what happens, and we'll take the lessons learned and then try again. Like, we're going to do 14 because that is meaningful change.
Building healthy communities really means everything. It means building healthier schools, it means building healthier homes, it means walkable sidewalks, it encompasses everything.
A couple of examples of how building healthy communities actually worked. We heard from community leaders in our healthy community sites. We have these 14 healthy community sites. We gave them our view of what a healthy community looks like. We said, what's yours? And so we heard and listened, and there were some things we didn't expect to hear. Among them was the issue of the school-to-prison pipeline, the over-incarceration phenomenon that has happened in so many low-income communities across the country.
I dropped out of school without even having a second thought, because dropping out of school was regular.
Boys and men of color are more likely to be targeted disproportionately by school disciplinary practices.
Our original impulse was to say, no, this is not our thing. This is not health. This is a very different domain, and we should probably stay in our lane. But we kept hearing it. And so we started actually reaching out to people who were doing research in the field. And they told us that, this is a big issue. And there are more kids, roughly 400,000 plus, kids that get suspended and expelled from school every year than graduate. And so we got involved.
Watching the power of authentic youth voice, authentic community voice, join forces with advocacy training in the Capitol, with using the public media, telling your story to a newspaper or to a television outlet, using social media to get this conversation going. And lo and behold, when you do that, then it becomes bigger and bigger, and suddenly there are tens of thousands of young people and their allies, day-to-day folks in community and people in power joining this, what became a real movement for a reform of school discipline in California.
Long story short, 3 years later, school suspensions are down in the state of California by 30%. As a result of their leadership, 5 bills went to the legislature that the governor signed. And so we have a new policy framework emerging in the state of California around school suspensions because that's a good way to pinch the prison pipeline.
The Boys and Men of Color initiative and the campaigns that have helped to drive it have played such an important role here because it gets to the heart of the equity issue in California.
In our neighborhoods, we are 5 times more likely to be murdered than girls and young women, and 7 times more likely to die from gun violence.
So, in our Building Healthy Communities work, the only population that we specifically called out in our 10-year plan is boys and men of color, because when you look at the social determinants and look at the targeted universalism approach, you look at boys and men of color, and they're the most impacted by the disparities. So what's emerged out of that work is this real focus on the need to provide space for healing and addressing trauma.
That campaign, starting with Boys and Men of Color, has really lifted up questions of equity. The zip code campaign that we launched, I think, was a particularly graphic way of calling out the gross differentials in health outcomes associated with race and gender and age. And so I think the Boys and Men of Color campaign has been a healthy narrative changer. One of the things we learned when we went into some of the most disadvantaged communities in California is that one of the most basic paths to a healthy community, health coverage, being able to access basic preventive care, was denied to giant swaths of our population because of their income, because of their immigration status, a number of reasons. So we've been very involved with our community partners in trying to do outreach to people, let them know about the benefits of Obamacare.
When it was being challenged in the Supreme Court, the California Endowment was the only philanthropy that decided to join in a legal proceeding that really supported the establishment of the Affordable Care Act.
There have been so many people who didn't have health insurance, who were fearful of the system, or who just were not aware of the system and the changes in the law, have now come forward because of that tremendously effective, diverse outreach.
It's now well over 2 million people who we've helped to enroll in Medi-Cal alone. Those are low-income people who were uninsured, really had no path to insurance, who now do.
And I've seen it, where people who are not going to enroll or who were not aware of the program actually got the information and now have insurance or health coverage for the first time in their lives.
So when the Affordable Care Act passed, that allowed a pathway for most uninsured Americans to get covered. Many immigrants, and particularly undocumented, were left out of that equation. And we began to hear noise from leaders, community leaders, about that. What about us? And what was transformative for us was engaging what is now known as the Dreamers.
I'm a Cali girl.
I grew up in South Central,
past Sacramento,
San Fernando Valley,
East Los Angeles.
Undocumented immigrants.
I came here when I was less than a year old.
Younger.
4 years old.
Who, rather than allowing someone to speak on their behalf, began to articulate what a healthier, more inclusive future might be for them.
Being a teacher, a lawyer,
a doctor.
Health happens when we dream together.
So the Health for All campaign wasn't dreamed up by some PR firm. It actually came from the young people, the dreamers, who have been shut out because of their immigration status.
Sickness doesn't look at you and tells you because you're undocumented, you can't get sick.
So given an opportunity to tell their stories, to courageously put themselves in front of cameras or in testimony in the Capitol, these young people are the ones who gave this campaign its momentum and its energy. They fueled it.
And so we've seen public attitudinal shifts about health care for the undocumented. That's another example of where the Building Healthy Communities, and I'm not saying we're responsible for all that, but we've contributed to articulating a new narrative about oppressed and marginalized leading the fight themselves. trajectory in the development of the California Endowment goes from what was initially seen kind of as mostly a healthcare foundation to a foundation that thinks about health. And now in the next iteration of the endowment, we're maturing into an organization that actually thinks about health justice and health equity, right? Someone needs to pay attention to the space of inequity and the space of inequality and the space of injustice, right? And in our case, we come at it through a health lens. But this nation just can't get greater unless we spend focused, intentional time and energy on inequity and injustice, and realize that if you're not in the battle for it, then you're complicitly in the battle against it. And that's what philanthropy has really got to understand. That's what I think we've learned at the California Endowment. We're still learning how to make that right and do better by it, but it's very, very much from those early days at a foundation board, what they conceived of, in our values and our principles and our DNA. That's the work that we do.